Hello everyone, it's Dr. Deva and this video is about C-section uterus ultrasound. These are the longitudinal transvaginal images of the uterus after a cesarean section. These curvilinear hyperechoic structures are the sutures. And over here, this is the uterine wound. It appears as a focal hypoechoic area at the site of incision. These appearances are normal after a C-section. Here is an image of a normal Cesarian scar. It can appear as a hyperechoic line at the site of incision in the myometrium. Also, the endometrium will be deviated towards the scar. On the right side is another image of a C-section scar. There is a focal hypoechoic or anechoic area with some fluid, and the deviation of endometrium is greater here. These are the appearances of a Cesarian scar. A bladder flap hematoma refers to a collection of blood between the bladder and uterus, which can occur after a C-section. The bladder is present here, anterior to the uterus. This hematoma will be heterogeneous, with solid and fluid-filled areas. If it gets infected, gas will be seen. We will see dirty gray posterior shadowing in case of gas. Here is our transabdominal image of the bladder flap hematoma. The hematoma is present between the bladder wall and the uterus. This is another image of a normal Cesarian scar. It is hypoechoic line in the myometrium. In a Cesarian scar, there will be a hypoechoic defect in the myometrium at the site of a Cesarian scar due to tethering of the endometrium. Blood has accumulated in this defect. The defect has various shapes. This is an irregular shaped defect. This defect has a linear shape. Endometrial fluid is also present. In this image, there is a large accumulation of endometrial fluid. This defect has a teardrop shape. Triangular shaped defects are common as well. We can see a proper triangular shaped defect here. Cesarian scar pregnancy is very rare. It is a type of ectopic pregnancy, but it is not an accurate term because the gestational sac is still implanted within the uterus. The gestational sac is present in the Cesarian scar. Here is another image of a Cesarian scar pregnancy. We can see embryo very clearly here. This is a transabdominal image of a Cesarian scar pregnancy. The gestational sac is seen within the Cesarian scar.